Welcome back. In topping your health news, after a severe tick season in the U.S. last year, experts are bracing for another year of a growing threat. And while you've probably heard of Lyme disease, there are other tick-borne illnesses of concern. Mandy Gaither has a look at the data.
A potentially life-threatening tick-borne parasitic disease called babesiosis infects red blood cells, and experts say it's on the rise in the U.S.
Patients can be hospitalized and they can develop multi-organ failure and even death.
Dr. David Leaf with Mass General Brigham Department of Medicine says for most patients with babesiosis, antibiotics will treat the illness, but for those who are most vulnerable to severe disease like older patients, those who are immunocompromised, or patients receiving chemotherapy, Leaf says antibiotics may not be enough.
When those patients get very sick, they sometimes receive a therapy called red blood cell exchange transfusion.
Leaf says it's a way of exchanging the patient's infected red blood cells for healthy ones. In this study, he and a team of researchers analyzed data on more than 3,000 patients with severe babesiosis over a 15-year period. They found the more invasive transfusion was much more effective at treating severe babesiosis when compared to the standard treatment.
They were more likely to survive the hospitalization, and they were also less likely to be readmitted after they were discharged.
Leaf says reported cases of babesiosis have increased over the past several decades in the U.S., and this research has the potential to save the lives of those with severe disease.
For the first time, we now have evidence that this therapy actually works.
For Health Minute, I'm Mandy Gaither.